This sound is what Americans fear they can't afford. This weight is what Brits fear they can't survive. Two different nightmares, but they share the same shocking truth. You're being failed by a system that started breaking 75 years ago, and the people in power like it that way. What if I told you your health isn't their priority? That whether you're in America or Britain, you're caught in a system designed to make someone else rich or keep someone else in power. That you're essentially a human cash machine in a 75-year experiment that's gone terribly wrong? I am going to expose the 3 dirty secrets that both healthcare systems do want you to know. Secrets that will change how you see doctors, hospitals, and politicians forever. And I'm going to prove how this isn't just about healthcare, but about control and profit at the expense of your well-being. Let's start with the American system and its first dirty secret. They profit from your sickness. Think about it. A healthy person doesn't generate ongoing revenue for pharmaceutical companies. A cured patient stops expensive treatments. The entire business model is built around managing chronic conditions rather than curing them. Those impossibly confusing medical bills, the endless insurance paperwork that feels designed to make you give up. That's not poor administration. That's a feature, not a bug. Every layer of complexity is another opportunity for someone to take a cut while making it harder for you to get what you owed. Now let's cross the ocean to Britain's NHS, where a different but equally troubling reality exists. The NHS was born from beautiful ideals, healthcare free for all, paid through taxes. But here is what they do tell you, a system that is perpetually underfunded will always need you to be, well, patient. Those endless waiting lists aren't just bad planning. They're built into a structure that trains you to accept less. When you're told to wait 18 months for a surgery that could change your life, you're being taught to lower your expectations, to be grateful for whatever crumbs of care you receive, no matter how delayed. Which brings us to the second dirty secret that will make you see red. Both systems are converging into the same monstrous hybrid. Look at Britain today, where private healthcare is the fastest growing industry. Why? Because those with means have discovered they can pay to jump the queue. Their taxes are supposed to eliminate. And in America, the government now spends more per person on healthcare than the UK spends through its entire NHS system. We're witnessing the birth of a 2-tier medical caste system on both sides of the Atlantic, where the wealthy get immediate, world-class care while the rest of us get excuses and waiting lists. But the third secret, the one that should keep every politician awake at night, is the biggest lie of all, that we have to choose between these two broken systems. They want you fighting about American capitalism versus British socialism. Because while we're distracted, both systems continue serving the same masters. In America, it's pharmaceutical and insurance companies' shareholders. In Britain, it's politicians who use the NHS as a political football rather than fixing its fundamental flaws. The current arrangement makes certain people incredibly wealthy, while keeping others securely in power, and your health is the casualty. So where do we go from here? The solution isn't about choosing between these two failed models. The answer lies in a third path that innovators around the world are already exploring: systems that put patients before profits, prevention before treatment, and outcomes before paperwork. Countries like Germany and Switzerland have found ways to blend efficiency with compassion, innovation with accessibility. They've proven there's another way. If only we have the courage to look beyond the false choice we've been sold. The 75-year healthcare war is over, and here's the brutal truth: we all lost. Americans face bankruptcy for getting sick. Brits face endless waits for basic care. And both systems are creating generations of people who've learned to fear getting sick. But the next 75 years don't have to look like this. If you're tired of being treated like a revenue stream instead of a human being, if you're done watching loved ones suffer in systems that seem designed to fail them, then you need to understand what comes next. This is more than a wake-up call. It's a prescription for change. The real treatment begins when we stop accepting the lies and start demanding better. In our next video, we'll expose the real cure for this broken system, and I promise you, it's not what any politician or pharmaceutical executive is telling you. The revolution in healthcare won't start in Washington or Westminster. It will start when enough people say enough. When we stop being patients and start being citizens who demand the care we deserve. Are you ready to be part of that change? The first dose of truth is just one subscribe button away. Your health and your children's health depends on what we do next.